Good afternoon, everyone. Thank you very much for taking the time to join us in this webinar today. And this is for families and friends of people living with dementia. My name is Iracema Leroi. I'm Associate Professor of Geriatric Psychiatry at the Global Brain Health Institute at Trinity College Dublin. And I'm one of the directors of the Dementia Academy, which aims to support the knowledge and practice of frontline clinicians. So this is the third in our series of dementia-related webinars. Our first two were aimed at professionals working in the field, and they have been recorded, and there are transcripts available on the Dementia Academy website. So people can tap into those whenever they want. And in those webinars, we addressed issues such as the management of dementia-related symptoms in the COVID-19 context, adapting memory clinics to the current circumstances, including the use of teleneuropsychology, and we also addressed some complex decision-making, such as advanced care directives. But today our focus is on family and friends. And we've had a number of questions to address to our panelists. And as before, this will be recorded and available on the website with the transcript following today. So the reason today's webinar has been requested is because there are many people on the front line of caring and supporting an individual living with dementia. And many people are feeling that they've been abandoned and ignored by the system. And they're looking for help, guidance, and support. So while we certainly won't have all the answers for you, we hope that today's discussion will help somewhat to support care partners during this very challenging time. And we strive to ensure that our information is accurate, practical, and meaningful. So I'm just going to introduce our panel now. So the first person on our panel is Zena Aldridge. She's an Admiral nurse working for Dementia UK, and she's been supporting people with dementia and their families for many years. So we'll just ask Zena to say hello.
Hi, everyone.
And the next person is Diana Burgui, who's a medical social worker from the Memory Clinic at Mercer's Institute for Successful Aging at St. James's Hospital, Dublin.
Hello, everybody. Good afternoon.
We also have Dr. Joseph Kane, who's a clinical academic and consultant geriatric psychiatrist at Queen's University, Belfast.
Hello, everybody.
And finally, we have Dr. Clara Domínguez Vivero, who's joining us from Spain. She's an Atlantic Fellow in Brain Health at the Global Brain Health Institute, Trinity College Dublin. And she'll be coming at the end of this seminar to share with you some information, links, and online resources which she's collected for you and putting all in one place so that you can easily access that through the Dementia Academy website.
Hello, everyone.
So we're going to kick off now. So we have a number of questions and we hope we can get through them all. If there are any additional questions, please put them in the chat and we will address them after the webinar. We've kind of got four categories of questions. First of all, a few general issues. Then we'll address questions from people who live together in the same house, a care partner and somebody with dementia. Then a few questions about people who live apart and supporting somebody who's living in the community but not in the same place. And then finally, we have some questions about people regarding care homes. So let's kick off and start with the general questions. And I'm going to pose my first question to Joe. Joe, the question is, are people who live with dementia at higher risk for getting COVID-19?
This is a really good question. We're finding more and more out about COVID-19 every day. But I think it's fair to say that we definitely don't have as much information as we would like when it comes to the connection between COVID and dementia itself. What we are seeing and hearing from our patients, however, is that all these things that we've all had to learn, like social distancing, like changing our behaviour, has become all that more difficult when it comes to helping people with dementia understand them. So although we don't have any good evidence to suggest that there is a connection between COVID-19 itself and dementia, I think it's fair to say that we all suspect that in individuals with dementia, the risk is a little bit higher. I think this is almost certainly the case in care homes, where we know that there is a higher concentration of individuals, both with dementia and with COVID-19. And there's a lot of movement between staff and visitors and everybody else. So I think it's fair to say that they'll almost certainly be at a higher risk. However, I don't think we're quite able at this point in time to put a number on it or really make sense of the information that we do have when it comes to risk.
Thank you, Joe. And that information is going to be emerging over the next few weeks, and we'll try to keep on top of that so we can share it with you as it does. So the next question I'm going to pose to Zina, and this is from somebody who attends a memory clinic with her sister who has Alzheimer's disease. And these visits to the clinic have now stopped. And she's very concerned that her sister with Alzheimer's disease is becoming more confused and needs her medications changed. The clinic is no longer offering appointments. What should she do?
Well, again, a very useful question for many, and certainly a lot of people are saying that they are struggling to get appointments with memory services. However, they tend to be the more face-to-face appointments in terms of domiciliary visits or actual clinic appointments. Most memory clinics do have telephone appointments that they are able to offer. Of course, in the context of this particular question, it's also important to ascertain whether it is the medication that is the issue, because there are so many fundamental changes to our lives at the moment and our routines that we must make sure that there's not anything else untoward that needs to be resolved. So alongside accessing the memory clinic, which of course would be my first port of call if that's what they're suspecting is the problem, via a telephone appointment, it may be that we need to consider looking towards a GP for advice about whether there is any other acute problems going on that need to be looked at. Because of course, they are still open. The NHS and health and social care is still open. And I think it's really important that people are not reluctant to seek advice and wait until lockdown is over.
Thank you, Zina. I think that's an extremely important point, that people don't wait until lockdown is over, because we don't know when that's going to be, and it's likely going to be graded. So services will take it a while to get open again. So please contact health services if you feel there's a need. And I think the other point is not assume that everything is the underlying dementia getting worse. It's very important to think that this may be a manifestation, possibly of COVID-19, if a person becomes more confused, less able, or possibly even developing agitation or aggression. So those are just things to keep in mind and discuss with either the GP or the service, or the memory service. So I'm going to pose the next question to Diana. So this is from somebody who describes themselves as having a very close extended family, with the grandkids normally being in and out of the house all the time. But of course, they haven't been able to do that for the past several weeks. And this care partner's husband, who has dementia, is now very bored and lonely, and is starting to become quite tearful and keeps asking where the grandchildren are and why aren't they coming.
That is a very real and a very sad situation these days. I suppose very practically, boredom arises from the changing routines. So practically and emotionally, what were those grandkids bringing to the house that is not happening now? Certainly, when a person is tearful, I recommend to let the emotions flow, not to suppress those emotions, and just to ask gently, who is it that you're missing? How old is he? What does he look like? When is the last time? Just try to encourage a little bit of the conversation around the grandchildren. Bring some photographs, and then practically, maybe he's not able to see them in the flesh, but can they organize a video call perhaps? Like, there are things that with a tablet or with a smartphone can be done, and families with this lockdown are having to get creative around it, and then organize a little bit of activity. If the grandchildren were helping with some exercise, see if there is a possibility of fitting in a routine of exercise and then mentioning the grandchildren at the same time. So that's possibly the best thing that can be done. Just try to fill the gaps of the activity.
Thank you, Diana. So the message is be creative and try all means, but definitely try to keep the contact going as much as possible, even different from before.
Yeah, and also there isn't much of a point in trying to rationalize why is it that they are not coming. Look, there is a very bad flu out there, and we don't want them to catch it, and you can't catch it from them. And then move on. We'll keep talking about those grandchildren who mean so much for that grandparent, and saying, it will happen when things get better, but tell me about them, and you encourage the conversation and the expression of feelings.
Super. Thank you very much.
Mm-hmm.
Joe, the next question is for you, and it's a little bit of a tricky one. The question is, will getting COVID-19 make the underlying dementia worse in an individual who has dementia?
Yeah, that is another tricky question. I think this is another one where we have to recognise that we don't have as much information and as much research as we would like on the topic. So we don't know for certain if there's a direct influence from COVID on dementia itself. However, what we do know is that individuals with dementia do have a more vulnerable brain than the rest of us. And that brain is more susceptible to the effects of things like infection, things like change in medication, even something as simple as constipation. So it can take very, very little to influence the brain of someone who has dementia. And that's worth thinking about because typically we can see that when somebody's dementia appears to worsen over a short period of time, that it's less frequently to do with worsening of dementia than the effect of the infection or the effect of the change in medication or whatever. So it's really important to recognize that when it happens. And one of the reasons why it's important to recognize that is because that when that infection, be it COVID-19 or another infection, is treated, or when the body overcomes it, that person's memory and thinking can return back to where it was beforehand. So if anyone tuning into the meeting is seeing that in their loved one or in a family or friend, they should not be thinking that this is a progression in dementia. They should be thinking that is there something else going on like COVID-19, and they should be getting medical help pretty urgently, because this is something that could be somewhat reversible.
Super, thanks, Joe. And I think it's starting to emerge that people often are having quite long and complicated recovery periods. So the confusion or the worsening of cognition resulting from an acute infection may go on for a long time. Okay, so the next question is for Zina. Many care partners feel that they can find practical solutions to several issues that have been raised, but it's much harder to handle the feelings of hopelessness, helplessness, and particularly loneliness. And people describe that at times they feel quite overwhelmed.
I think that's getting worse as this time period goes on. I think people initially wanted all the practical solutions, how they're going to get the shopping, how they're going to get the medication, all the very, very practical day-to-day things. And as this becomes more intolerable and more intense as time delays, people are neglecting their emotional and psychological well-being, because a lot of the coping mechanisms and things that were in place to support that may have been stripped away overnight effectively. So I think it's broader than just those emotions. It's about recognising the emotional state of family carers constantly and being kind to themselves, acknowledging that they need time for themselves. And that's going to have to look very differently given the state of affairs that we're with constantly now, of course. So, it's not a case of someone going to daycare or a carer coming in and sitting with someone. It may be about more creative opportunities to have some time to themselves, spend some time on IT, engaging with family and friends and talking about their feelings, because it's about finding other resources that we can talk to and value that this is an important part of staying well through this crisis. Our emotional well-being and our mental health is critical in enabling us to get through this process. So there are lots of telephone support mechanisms that people can access if they don't feel that they're comfortable and haven't perhaps got family that they feel able to disclose some of those feelings to be able to offload and understand that these are normal feelings, they're acceptable and appropriate given the context of the situation that they're living within.
Thank you, Zina. So I think the key message is reach out, you're not alone. Many people are experiencing this, and some of those access points and numbers are listed on the website, including your own organisation, Zina, Dementia's UK, which is a 7-day helpline that can be accessed from anywhere in the world. And also there are other sites, for example, Age Northern Ireland with check-in and chat. So there are a number of resources. Again, please do look at the website.
And I think it comes back to not letting it go on for too much longer. You know, don't wait for lockdown to end. If you're feeling distressed, reach out for help now.
Thank you. It's just a phone call. So the next question I'm going to pose to Diana. And so this is a family who, before restrictions and physical restrictions and lockdown were put into place, they were already making plans to move their mother, who has dementia, into a care home. So they'd chosen their care home, they'd agreed upon it. However, they are now frightened to do this. They feel that care homes are dangerous places and they're wondering what they should do. It's clear that their mother can no longer live on her own, and the family lives far away with very little means of providing the support that she needs.
In principle, first thing I'd say is that moving to a nursing home should be the last resort. And to find out whether it is the last resort, you need to take a step back and ensure that the exploration, the decision making is properly conducted. To do this, think back, make sure that you have reached a joint decision with the person with dementia, him or herself, with the family and the healthcare professionals. Gauge what the care needs are, what the risks are, and warning, there is no life without risk. And gauge as well what the wishes and preferences of the person are. And we don't need to agree with them. They may want things that we may not agree with, but they still have the right to choose. And think as well, whose decision is it to move somebody to a nursing home? Like even the language is very depersonalizing and not person-centered. You are moving someone like they have no say in it. Now, if you're satisfied that all the care planning has been done and that it isn't, I suppose, the best way to meet the care needs of the person is in a care home and in a nursing home, the best thing to do is to carefully choose the home. And there are lists produced by Alzheimer's Society, HUK, even the Which magazine, and here in Ireland by the HSC or Nursing Homes Ireland, about what to ask. You know, when choosing a nursing home, what should you be asking? What matters? And it's a combination of practical and emotional. You should go and see it with your own eyes and get a good feeling. The person with dementia should also go and see the nursing home and combine that feeling with the outcomes of formal reports or inspection reports where authorities are saying whether that care home is doing well or poorly. Now, what COVID-19 brings to this, I suppose, what extra questions should you ask? If they have or had COVID-19 in the facility, what measures were they implementing to prevent cross-contamination or cross-transmission? What are the protocols for transferring patients to the nearby hospital? So that would be the main questions. But the principle would be, this has to be the last resort. See if there is any way that you can get through this difficult time without making that decision.
Thank you, Diana. One of the very complex decisions that need to be thought about very, very carefully. So anyone in that position, good luck with that, and do reach out for support and help if you need it.
Yes.
The next question is for Jo. This is from someone who says, my mother has lived with dementia for 7 years and lives at home. If she gets unwell, should I take her to hospital? I'm afraid she will die there.
I really sympathise with this question. I think a lot of patients and their carers are facing similar decisions, and people can feel that they're in a catch-22 situation where they can't really pick a right answer to this. What I would say is that the answer to this depends on the individual and on the situation. And although we do know that COVID-19 is dangerous, and it's particularly dangerous to older people, we do need to remind ourselves the vast majority of patients do come through COVID. They do recover, and in many circumstances they don't even have symptoms. I have patients in their 80s and 90s, and some of them have very severe illnesses, but they have come through this. And we need to kind of bear that in mind when we're talking about any medical or social care decision making. So the question I would ask is, before COVID-19 and before the pandemic, would you have brought your mother to hospital? Would you have consulted the GP about her difficulties? If the answer is yes, you should probably be strongly thinking about it again. Secondly, and importantly, I think probably most importantly, is to try and work out what your mum would want in this situation. What would her wishes be? Is she the type of person that would wish to go into hospital and get as much treatment as possible, or is she someone who would prefer to be at home? If now, in order to do that, the simple way to do that is engage the person in that conversation and try and work out what their wishes are. That's not always possible in dementia because these are complex conversations. In that instance, it's a case of you, as somebody very close to your mother, trying to work out what she would have wished for and what she would have wanted, and trying to respect that. And if you're faced with any difficulty in making that decision, I would consult your GP or consult your local hospital. And finally, it is very fair to recognise that there are situations all the time when we send a loved one to hospital that there could be a possibility that there could be eventually a death or some very difficult news at some stage. And I think it's worth pointing out that as part of COVID, there has been a real emphasis on end-of-life care and a real focus on improving palliative care. And there are things that can be done both in hospital and at home that can make somebody's end of life much more comfortable and much more appropriate than it would have otherwise. That involves medications, but also involves other parts of care as well. And like I say, they can be provided both in hospital and in home. In order to do that, you need to engage with healthcare providers, be it your GP or the local hospital. So if you have any doubt in your mind whatsoever, my recommendation would always be talk to your GP, talk to your local hospital, but most importantly, talk to your mum and find out what her thoughts on the issue are.
Thank you, Joe, for handling that very sensitively. That's an incredibly difficult decision that people are facing, and it's certainly, again, one of these things that are common out there, and many people are wondering about this. I'll also just direct people's attention to some comments made by Dr. Karen Harrison-Denning, an Admiral nurse, who has recorded a short video clip about advanced care decision-making precisely for these kinds of circumstances, so that people make very clear what their decisions are when they go into hospital, and that the discussion has happened before they go. So that clip is available on the Dementia Academy website, and you can find it there. We're going to shift attention a little bit now to talk about people who live together, a care partner or a spouse or a family member with a person who has dementia, because there are particular issues in those scenarios that people are facing. So the first question is for Zina, and this is from someone who lives with her husband, and he has been diagnosed with dementia about 3 years ago. His usual routine has been to walk the dog every day, to go to the corner store, to buy his newspaper, and this daily routine has been very good for him. He's very chatty, he likes to shake people's hands. But of course, since physical restrictions and lockdown, he can no longer do this and has to stay indoors. So the question is, I've tried to explain why he cannot go out, and I've hidden the door key. He cannot remember. This has made him angry, upset, and even aggressive on occasions. How should I handle this?
Again, this is something we're coming across quite a lot as Admiral nurses. Several calls I've had this week actually have referenced this entirely. Again, it's about weighing up the risks and the benefits of certain activities, and it's very, very difficult to do that in the current situation. Depending on where you live, it is often a parameter and a barometer as to how you go about this. But certainly, obviously, keeping someone locked indoors is a deprivation of their liberty, even if we're trying to keep them safe. We need to ensure that we're not actually overstepping the mark and restricting someone beyond what we would class as acceptable. And of course, someone with dementia whose short-term memory is quite significantly impacted upon is not going to be able to retain the information every time that you tell them not to go out of the door. So it's about trying to find a workaround. Similarly to what Diana was saying about the grandchildren earlier, is there an alternative way of keeping them occupied, getting them some exercise? Are they able to go out into the garden? Do you have access to open space? Those kinds of things. In some areas, depending on how impacted someone's capacity is, we're suggesting that they still allow them to go out walking, still go out with the dog, because actually most other people who don't have dementia will give them a wide berth anyway and won't engage with the human contact. So again, it's about weighing up that risk. Thinking about as well, is there a different time of day when they're less likely to come into contact with people? Have you noticed that there's 20 people going down to the corner shop on such time, but later in the day there's nobody about? Is it safer to go then? Or can you go with them? Can you go out and take them for an escorted walk and have some exercise yourself as a couple during that period? Because I think, again, the longer this goes on, the harder it is to distract people within the confines of the family home, particularly when the weather's nice. To try and confine someone when the sun's shining is very difficult. A few of my families have suggested using the sunflower lanyards. So they are for people with hidden disabilities. So again, if people go out and they see someone with a sunflower lanyard, it's a very practical indication to them that that person might struggle with the social distancing measures at the moment, and to be a bit more concerted in the way that they address them if they do come a bit too close. Because obviously that's the fear, is that people with dementia could be vulnerable if they do invade people's space inappropriately at the moment with social distancing, and people retaliate and become a little bit aggressive towards them. So it's about balancing those risks and looking at each case individually. But I think, locking the door and keeping them in is probably going to only escalate their agitation and the possible incidents of verbal aggression. So I think it's about balancing that with the risk of them actually going out.
Thank you, Zena. Can you just point us in the direction of where people can get a sunflower lanyard if they're not familiar with that already?
I believe Sainsbury's was the biggest provider of them, the department store, but I believe you can get them online. I think they're about £1 each for a donation. And I know several people with dementia at conferences recently have said that they found them incredibly useful, particularly when they've been using public transport and things like this. So it may be that, not everybody's aware of the sunflower lanyard, but I think if we raise awareness of it, and it might be a tool at this point for people to wear something without saying a badge that I've got dementia on, which of course is not what we want to do. We don't want people to feel compromised, but it might be an indication to people that those individuals need some support while they are out and about in the community.
Thanks very much, Zena. Diana, can I just ask, is it the sunflower recognised in Ireland, or is there a similar kind of scheme that people...
No, I don't think so. This is a topic that we were discussing with the Irish Dementia Working Group, which stems from the Alzheimer's Society of Ireland. All that there is here is a card that people can carry and show it if and when they require, to explain to people that they have dementia, and that is why they may seem confused at some time, because there is nothing visible that I know of. I believe that in the north, and Joseph may correct me on this if I'm wrong, they have a card which is called, it's a kind of give me more time, I can't remember, it's an acronym. It's
Down card.
That's the one, yeah. But not a lanyard or anything similar to that.
Okay, that's extremely helpful. Thanks very much. Diana, if you can just stay with me for a minute. The question is now directed at you. It's for somebody who cares for a person living with dementia. They are both over 70, and this care partner is very concerned what will happen to the person she lives with if she herself falls ill. Mm-hmm. There's no one else she can call on, and her other sister, who's also elderly, cannot take over the care. So what will happen if the care partner falls ill?
What would happen? Well, look, anxiety and uncertainty about the future is normally there, but COVID has shaken all our assumptions, and everything we knew and everything we felt safe about, now we don't feel safe about. So the first thing that I can say is, look, live for today and keep anxiety at bay, and plan. Is the best thing that people can do. You can only control so much. And the old Yiddish adage, man plans and God laughs. Yeah. But it's still good to plan. And I'm taking a leaf out of Joseph's book here when he was saying that sometimes in terms of advanced care planning, it's too late. You cannot ask the person with dementia. Don't let it get to that stage. Ask now. It involves a lot of questions, and very often questions that children themselves feel worried about about asking, because they themselves are not prepared to have this conversation. And very often the older person would bring up, if anything happened to me, and then the younger son, well, younger could be 60, it could be saying, oh, no, that we're not going to talk about that. And they've missed on a great opportunity to gather properly the wishes of the person for the future. And that goes also for the carers, because carers often neglect themselves in benefit of the person cared for. And they need to plan for them when they are caring and plan for when they are not caring. So the best that they can do is plan ahead, let people know that you are there, that you don't have a close family, get a personal alarm so that you can contact somebody in case of an emergency, and have your plans written down. Beyond that, you need to live the life for today and manage this anxiety, which is not a pathological anxiety. This is only normal. It's a natural human response, which affects our thoughts, our feelings, our physical sensations. Try to manage it yourself, talk about it, write it down, normalize it. If you find it too hard, talk to professionals about your anxiety. Let people know that you don't feel a little bit comfortable about this, and they'll help you through it. But nobody can, get the present, the past, and the future. We need to live for today and bring our thoughts to where our body is. Our body's in the present. Our mind could be time traveling in the past or in the future, and neither of them is good. So we need to think for today. Take a deep breath and think, we'll cross that bridge when we get there, and plan for it.
Thank you, Diana. So no more time traveling. Thank you very much.
Traveling.
And again, coming back to it, help is a phone call away. Please pick up the phone. So Zina, the next question is from someone who lives with their wife, who has dementia and has had dementia for a number of years. She's become increasingly anxious, restless, and is not sleeping at night. And she's keeping her husband awake. So he is exhausted, and he's asked the GP to give his wife with dementia sleeping pills. The GP has refused, saying it'll make her fall and increase her confusion. Is there any medication I can ask for? And he says he cannot go on like this. He's absolutely sleep deprived.
Again, I suspect so many people are feeling this at the moment. And I think sleeping pills are only part of the solution to the problem. It's about identifying what the problem is first, because we have just gone into the summertime. When the clocks change, we do find that we have lighter evenings, we have very light mornings, so it does unsettle people's sleep pattern. There might be a physical reason why someone is not sleeping. If they are perhaps constipated, if they have got an infection, a urinary tract infection or something that keeps waking them during the night. And they may be sleeping too much during the day. So there are lots of things in terms of managing someone's sleep hygiene that we should be looking at before we look at medication. So things like not having caffeine late at night, making sure that you have a kind of a routine at bedtime. Again, trying to get some exercise during the day to see if that person can be, worn out, if you like, and ready to sleep at night. Because if you've been sedate all day and sitting in the chair, you're not necessarily incredibly tired when it's bedtime. So thinking about all of those things first. It's not to say that medication might not be part of the solution further on once we've eradicated any acute problem for the sleep changes. But again, it would only be short term to try and adjust that sleep pattern temporarily. It could be that actually what's needed in the interim is because these things are obviously not magic bullets. We won't actually prescribe a pill and something happens differently overnight. It may be that this gentleman needs or lady needs some social support for a couple of night sits, for example. It may be there needs to be some social care intervention to enable him to sleep and actually feel that he's more capable of resolving some of these longer term issues that might be needing addressing. And I don't know what it's like in Ireland at the moment, but social services here is very much open for business. I'm sure my social care colleagues will be able to confer the same as in Ireland. They will not want to be seeing people fall off a cliff and making themselves unwell. So there is still resources available. There are still packages of care available. And it may be that actually, despite the lockdown, it may be that we actually have to ask family members to come and sit with the person with them, or sit up and offer some support overnight. It's about that risk restriction. But fundamentally, if you have concerns about the sleep, I think it's about ensuring that all of those physical elements and environmental elements have been explored before you refer to the medication as the solution, because it may offer a short-term solution, but quite rightly, you know, what we don't want is someone falling and seriously injuring themselves in the first instance if there's other things that we can do to promote a better sleep for both of them at night. Because I would imagine if she's not sleeping, she's tired and exhausted during the day, is going to sleep more, and this is going to be a continuum rather than a short-term thing. So looking at that longer-term solutions is probably a key part of that going forward.
Thank you, Zina. That's really good advice. Sometimes it's also helpful to take the opportunity when the person you're looking after or caring for has a nap, that you take a nap as well, rather than taking the opportunity to rush around and do all the things that you weren't able to do when they're awake. And that's a tricky balance to strike, isn't it?
Absolutely. It's about adjusting to the new normal, isn't it, really, in a way? I think we get very set in our routines of, you know, we must stay awake all day and go to sleep at night. But sometimes it's about giving you permission to go, we need to knock that routine on the head and just get through the next 24 hours or 48 hours, and then we'll worry about the rest later. Because absolutely the carers need to look after themselves, because without them, you know, our whole health and social care system would collapse. So we need to make sure they do look after themselves.
Yeah, thank you. Joe, I'm going to ask you to address the next question. So we're moving into a couple of questions regarding people who live in care homes. And so this is from someone whose wife who has Alzheimer's disease and lives in a care home, which has been badly affected by coronavirus. And he's extremely worried that she will get it as well. And of course, he's not been able to see her. Can you provide any advice or reassurance to this gentleman?
Certainly sympathise greatly. This is a situation which is facing a lot of our patients and their carers. I think the first thing is to be very forgiving of yourself and recognise that it's part of your job to worry about and care for your loved ones, and that's all the more difficult when you're faced with both uncertainty and the prospect of not actually seeing the person that you really care about. For what it's worth, I'm not always sure that the statistics are helpful when it comes to reassuring people, but we do know that the majority of people, even in care homes, are recovering well from COVID-19, and that the care homes have learnt a lot over the past few weeks and past few months when it comes to managing, limiting the exposure of their residents to COVID as much as possible. And as distressing as it is, and as difficult as it is, it would seem to be a reasonably sensible decision on the part of some care homes to limit visitors, because the more you can control the individuals and the movement of people in and out of your building, the more you can control the spread. So I do understand the rationale there. But what I would say is that care homes are increasingly finding ways to balance limiting the exposure of coronavirus with the distress and everything else of individuals not seeing their loved ones. My recommendation to this gentleman, gentleman or lady, would be to first and foremost would be to try and get in contact with the nursing home and see if there's anything that they can do differently to make the situation better for both the patient and for their relative. And something like a regular phone call can be surprisingly transformative in situations like this for both parties. I've also got a lot of joy recommending that individuals speak to the care home about the possibility of things like video calls, and they can really make someone's day, both when it comes to someone in a care home and someone outside a care home. It's just a classic example of things that keep you well and keep the anxiety a few notches below what it normally is by using kind of good, tried and tested mechanisms. So my first recommendation would be, first of all, forgive yourself, and secondly, to try and get in contact with the care home and see if there's anything you can do differently to help both yourself and your wife. We're still finding our way through this, and we're finding new solutions every day, and it's just a case of just keeping at it and being forgiving of yourself.
Super, thank you, Jo. So just to share some information I had from a colleague of mine who's been able to get a small grant to supply several tablets or iPads to a number of care homes where she works. She's a geriatrician. And that's sort of an interesting idea if people have the means or ways of getting some iPads or tablets to the care home and asking the staff to set those up so that communication can be enabled if there isn't any other means. So the next question I'm going to ask Zina to address, and then Diana, if you've got any further comments to add, please jump in after Zina. And this is about how a care partner can manage so-called remote bereavement. So many people are now living with the loss of a person who has died either in hospital or a care home, and they've not been able to say goodbye. And now they're grieving on their own without the support of family or friends due to the restrictions. Zina, could you give us a few words about that scenario?
Absolutely. I think no matter what we suggest here, there is no correct solution to this. Grief is very individual. How it's felt is very individual. And these are unprecedented times. We've never known anything like this before. So not only are families having to experience the loss of the death, at the point of death, but they're also struggling with funeral arrangements or the rites of passage that normally people associate with that after death process, if you like. And certainly I've come into contact recently with a lot of carers who have said the funeral's been very difficult, where there might be only 2 or 3 members of the family. They've not been able to embrace, they've not been able to touch, and then they've just gone home. They've not been able to experience the wake, which of course for many is an opportunity to really reminisce and share those fond memories and start the grieving process. It's almost like that tick, isn't it, that kind of sets you on the next part. So I think it's incredibly difficult. So certainly there are ways about redefining how we manage those processes. So it may be that we have several places where they've put funerals on Skype, for example, and various things that people can attend online. Online wakes, those are sort of those initial things. But then when you get to the bereavement, it is that difficult thing of not being able to have the family and friends pop in as you might have done previously pre-COVID. So again, looking at what resources are out there that you can get some psychological and emotional support to talk this through, because we don't know when this is going to end in terms of being able to extend our bubble. We hope we'll have some solutions at the end of the week that will tell us that we can have more, but at the moment we don't know that. So it's about seeking support, acknowledging those feelings, and actually for some people, not feeling guilty if you're not feeling grief, because again, there are lots of people who are relieved. They don't feel that they need to grieve, and again, often need that support and that reassurance that that's normal and that's okay, because they feel guilty because they're not grieving. So I think it's about recognising everybody's individual way of grieving and trying to acknowledge that we have no control, similarly to what Jo was saying about the previous question. We don't have control over this. Be kind to yourself. There isn't a process that we must follow that makes it right or wrong at the moment, as there never is with grief. It's very personal and very different for each individual.
Thank you very much, Zina. That was very nicely handled. Diana, would you like to add something from your perspective?
Not that I can add a whole lot, because that was a beautiful answer, but what I would say is that on top of that, you cannot underestimate the value of practical support, because people I suppose on top of the emotional hit, they are having to get a death certificate and they don't know how to do that. They are having to talk to funeral homes and go and organize a burial or a cremation, and all that comes with it, and inheritance and declarations. So do reach out for support, and when help is offered, take it. There are social workers there very well placed to offer bereavement, primary care teams, which will help. The other thing that I would say is that I think people are torturing themselves thinking, I wasn't there when my relation died. And we have this idea of what dying is like that we mostly take from television. And in television, dying is, shaking and closing the eyes and suddenly dropping the head. And people think that there is a lot of pain with dying. So I think we need to talk about dying. And on this one, I will mention there is a palliative care consultant, Catherine Mannix, who has opened the conversation on dying. And I think it would be very beneficial for people to think that dying may not have been as bad an experience as they themselves may be torturing themselves thinking that it is. So that's on the dying, and I will give a link to a BBC talk of this lady, which I think would be very beneficial for the audience and for every one of us. And then on the bereavement, as Sina was saying, people grieve very differently. So what we need to do very often when we are caring for a person, they take up a lot of our day and a lot of our thoughts. We do need to fill those gaps and let ourselves know that grieving is a process and there's no shortcut to it, and that you're allowed to feel. So do not rush into anything, but try to keep a little bit of activity and contact with people. Unfortunately, this contact at the minute has to be remote and there are no hugs, but the hugs will happen and it will come. That's the best advice that I can give.
Thank you, Diane and Zina. That's extremely helpful. Joe, I'm going to direct the last question to you. It's a slightly different tack, but it may be of interest to some people. And then we'll switch to Clara, who's going to give us some points in the direction of some online resources. And this is about research. So this is from a family who's been approached by the university asking whether their mother, who has Alzheimer's disease, wants to participate in a research study to understand the impact of COVID-19 on the lives of people with dementias. Should they participate in the research?
I think that one of the characteristics of these seminars has been that there's a lot, it's made very clear where there are gaps in our understanding. And we've had to be very brutally honest sometimes and say that we don't know the answer to things. It's wonderful that research is being done, and it's wonderful that research is being offered to people, because that is the only way that we can tackle the gaps in our knowledge and the gaps in our understanding. The only way for us to make things better is to do this research. And people have an unusual perception of research. They think of white coats and they think of labs. And the reality is that one of the great things about research is that it's a really nice collaborative opportunity for people from different backgrounds very genuinely to work together towards improving a set of issues. And that's especially the case in COVID-19, where we didn't know about this illness just a few months ago, and now it dominates our world. That said, I think with all research, it's really important to look at what all research involves. And usually when someone's invited to take part in a research study, they're given an information sheet, which is usually at least about 2 or 3 pages, outlining exactly what is involved in the study. And I would encourage people to take the time to sit down and read it, have a think about it, maybe read it again, maybe have a chat about it. It really is a question of what is involved and how is that going to impact me and the person with dementia. And it's a case of weighing up the pros and cons. And the fact is that some of these studies might be a little bit too intensive. They might not. It's up for every individual with dementia and their caregiver to decide. And the best way to do that is to look at the information provided as thoroughly as possible. And if there are any questions, to use the number which has to be provided on those sheets to ask the researchers any questions they might have. I think the important thing to remember with all research is that you don't have to do it. It should be a choice. It should be a collaboration. And the other important thing is that if you decide not to do the research, it doesn't affect the way that your healthcare is managed. It doesn't adversely affect the level of your care, and certainly nobody will be annoyed at you. So in summary, it depends on the project, it depends on the individual, but read the information and try to come to as balanced a decision as you can. And if you can, wonderful. Congratulations on helping us make the world better through improving our knowledge.
Thank you, Joe. I think that's extremely good advice. So the information will be provided. If it's not, then you should ask for it. And also don't forget, you can talk to your GP as well to get advice and their opinion. But ultimately, the decision is the person living with the condition, the person with dementia, it's their decision, unless they do not have capacity to make that decision, in which case there are certain safeguards that should be clearly outlined in the research for how that should be managed under the Mental Capacity Act. So we're coming now to the last 10 minutes, and I'm going to ask Clara to run us through some links to information that we've been referring to, and also other things which you may find helpful. And all of this will be posted on the website. Clara.
Okay, thank you, Iracema, and hello, everyone. So first of all, like several resources on how to care of our beloved ones at home and in the community. So first, the Alzheimer's Society of Ireland website, I found particularly interesting these subjects of services still operating in Ireland, changes in behavior, and supports available. There's also all these labels you can access to about engaging in activities at home, activities and information for families. As an example, this really nice presentation on 101 activity suggestions. So if you're running out of ideas, this is a good place to come to. And this amazing presentation with a lot of links to very good resources. I mean, this is just the first slide, but there's many of them. So just go and take a look, because you're for sure gonna find something that will help you. Also the weekly activity planner, which can be really helpful to establish a routine that it's very needed during this situation. This other website, the Living Well with Dementia in South Tipperary website, also offers some very good resources, and I actually was the only place in which I found one specifically devoted to talking devices and products that are to be used with people with dementia. So I thought that was interesting, and also the exercise program. The Alzheimer's Society United Against Dementia website has also a comprehensive resource hub, and you can find anything you need. Particularly how to protect yourself and others, and also activity suggestions, and how to support a person with dementia who falls ill, which is also a situation many people can find themselves in. Finally, Alzheimer's Scotland has more or less the same resources, but what I like about this website is that there's videos and webinars on all these topics you can see here. So if you feel more like watching a video than reading a text, this can be a good place to go. The Ideal Project has this very easy and brief leaflet on how to stay well during the coronavirus outbreak. The UCLA Health website offers these training videos for caregivers. In case you're struggling with anything listed here, you can see very good examples on how to try to cope with this. And then also these leaflets are very user-friendly and very nice to read, and they offer very good advice on how to stay well at home with someone with dementia during the lockdown. Particularly this one in this appendix has very good advice on how to deal with many of the behaviors that we can be struggling right now. So, but 24 hours taking care of someone with no way out, everybody needs to zoom out from time to time. So the website Breathworks offers mindfulness free practice and the quiet place for key workers. Also, this website of bringing you mindfulness free resources, it's very nice and easy to use, and it has a lot of helpful reads. There's also this specific YouTube series on relaxation for caregivers. There's, I think, 10 videos that you can take. And then I highly recommend these 4 TED Talks that will feel you a little bit empowered and also feel that you're not alone. There's millions of people around the world undergoing the same situation that you are in, so you will really enjoy them to relax. Regarding the issue about if it's time to make a move to a nursing home, these 2 links here are interesting readings about this. And then I think Diana mentioned these websites. So Age UK, how to choose the right care home for you, and also the WITCH website. But as she said, it's not time to take fast decisions. So just give it a thought and take a look at these resources. What if the person we are taking care of or us are falling sick? This Family Carers Ireland website offers the emergency care plan. So take a look, because it's good to be prepared if this happens. And regarding bereavement and grief, the Center for Palliative Care offers very good resources to advance care planning and to start conversation with the people we are taking care of about this issue. Also, this resource for Healthcare Foundation Trust is very good, also a bit long, but if you want to go deep into this, just take a look. The Irish Hospice Foundation offers a lot of advice, particularly very practical advice on how to run a funeral in these exceptional times, and also caring for someone at home, and what you should expect if someone that you're caring of at home and you don't want to take to hospital, or you want to take to hospital, what should you expect? And finally, as Diana recommended, this talk about dying is actually not as bad as you think. If someone is struggling with this idea, or just take a look at this video, because it will really help you. I just saw it today, and it's really amazing. And just to give you some hope, every day is a new beginning. Take a deep breath and start again. This is gonna end soon. It's already being better in Spain, so keep going, because it's gonna get better.
Thank you, Clara, for that amazing collection. So I think the message is that no matter what your question is, there will be an answer. And if not, reach out to us. So we have 2 minutes left, and I'm just going to spend 1 minute sharing with you something that is quite nice, and it came to me through my email. Just before the lockdown, I'd signed up for an Irish sports initiative called Swim for a Mile. Now, of course, like everything else, that's been cancelled, but Swim for a Mile team sent this out, and it's an anonymous little piece, but I thought it touches some very nice points. So I'll read it for you. We are not in the same boat. I heard that we are all in the same boat, but it's not like that. We are in the same storm, but not in the same boat. Your ship could be shipwrecked and mine might not be, or vice versa. For some, quarantine is optimal, a moment of reflection or reconnection, easy in flip-flops with a cocktail or coffee. For others, this is a desperate financial and family crisis. For some who live alone, they're facing endless loneliness, while for others it's peace, rest, and time with their mother, father, sons, and daughters. With a weekly increase in unemployment, some are bringing in more money than when they were working. However, others are working more hours for less money due to pay cuts or loss in sales. For some not getting on with family, domestic abuse is rife. We never know what goes on behind closed doors. Some people are spending 2 to 3 hours a day helping their child with online schooling, while others are spending 36 hours a day supporting a person living with dementia. Some have experienced the near death of the virus, some have already lost someone from it, and some are not sure if their loved ones are going to make it. Others don't believe this is a big deal. So friends, we are not in the same boat. We are going through a time when our perceptions and needs are completely different. Each of us will emerge in our own way from this storm. It is very important to see beyond what is seen at first glance, not just looking, actually seeing. We are all on different ships during this storm, experiencing a very different journey. So let's be kind and support one another and find time to be grateful and enjoy life's smallest pleasures. Thank you very much, and thank you for spending the time with us. Goodbye.